Hey everybody, how you doing? Uncle Vinny here. Grab a cup of coffee, sit back, relax, and enjoy the show.
Hey everybody, I'm Dr. Nick Circolone. I am so excited to be here as always, and thank you so much for tuning into our show. Today we're going to have a continuation of our show from last week. Remember last week we talked about why people are afraid of chiropractors? Today we're going to talk about why doctors don't refer to chiropractors. The reason why most medical doctors don't refer to chiropractors because they don't know what chiropractic is or what the chiropractor does. What they see is what everybody else sees. They'll go on YouTube and watch some of the videos where they're snapping and cracking and trying to get the loudest pop that they possibly can.
There. Ooh, that's a good one. Big Philly from the block. There. That's a good one.
And I will tell you what, I've shown my medical doctor friends some of the videos and they cringe at what they see. They say, "Do you do that?" And I go, "No, that's not what I do." Because they don't know, they assume that every single chiropractor does the same exact thing in their office. And that's not true. I personally, when a patient comes into the office, we treat them like they were a patient going to any medical doctor. We just treat them with manipulative therapy, where your surgeon will treat you with surgery, your family doctor would most likely treat you with medication. But chiropractic, what we do is manipulative therapy. We throw a little bit of physical therapy modalities in there. We'll do stretching. And what we do is we're getting the patients out of pain. That's a little anatomy lesson. When you get adjusted, you're not just affecting a nerve. You're affecting the joint. You're affecting the nerve. You're affecting the vein, you're affecting the artery, you're affecting adipose tissue, which is fat tissue, and you're affecting the lymphatic system. There's a lot going on when a manipulation is done. So you have to be very careful on how it's done and who it's done on and the technique that you use, because there's a lot of techniques that can be used to help facilitate that movement of that vertebra or that joint in specific to help relieve the pain. And that's where a lot of medical doctors get a little nervous. They're like, "How are you doing this? This doesn't seem right. This seems like it's going to hurt my patient." And when you look at some of the videos, it really looks like these patients are really getting hurt. And some do. Don't get me wrong. Sometimes a manipulation will cause pain to a patient depending on how it was done. That's why the doctor has to make sure that he knows exactly what's going on with that patient so they can treat them for exactly what they have. A lot of times, patients will go into a chiropractic office and they'll see the chiropractor several times because understand, chiropractic is a therapy. It's not a one and done. Sometimes it is, but most of the time it's not a one and done. So when you go to the chiropractor, you have to understand that there's a treatment process, just like with physical therapy. It may take several visits for you to see relief. But if you are going to the chiropractor and they're adjusting you the same exact way every time you go, or they're in the office with you for 2 minutes and then out and next patient, next patient, next patient, that's not really what chiropractic's all about. Chiropractic is a specific discipline in which we pinpoint the area of injury, the area of complaint, and we focus on that to help clear that up and get the patients out of pain. Unfortunately, medical doctors can't see this. They read in that chiropractic is beneficial for musculoskeletal pain, but they don't refer because they don't see the consistency with the doctors. And as a chiropractic orthopedist, my job has been going to these medical doctors and other type doctors and showing them the validity of what we do and that we're not going to hurt their patients. Now here's the thing, most chiropractors do not know how to communicate with medical doctors. They'll get a patient and they won't know, well, what do I do now? How do I refer to them? How do I contact the doctor, let him know what I'm doing? It's as easy as picking up the phone. When you call the patient's doctor up and you say, "Dr. So-and-so, I have Miss Smith in my office. She's coming in for low back pain. We're going to be treating her conservatively for the next several visits. We'll do some x-rays. If necessary, we'll have an MRI done. if we need any assistance from you, can we count on you? 9 times out of 10, the doctor's going to go, absolutely, that sounds great. Let me know what you need. Very rarely do I get a doctor going, oh, I don't want you treating them. But I will say this. I do have patients that go to their doctor and say, oh, I'm seeing a chiropractor, and they'll roll their eyes. And I'll say, did you say that you saw Dr. Circolone? No. Next time, make sure you tell them you saw Dr. Circolone and see the reaction change. And it does. The reason is that I'm honest with them. I don't go beyond my scope of practice because some doctors think that chiropractors can cure every disease, because years ago, a lot of chiropractors were talking about, I can cure this disease, I can cure that disease, I can cure this ailment or that ailment. That's not true. There is no cure for some of the symptoms that patients have. So we can never claim that we're curing that. Now, do we treat patients with these symptoms that are outside our scope of practice? Absolutely. Good example is somebody who has cancer. They have a lot of pain. They need some relief. Chiropractic is very beneficial to them. Am I treating cancer? No, I'm not. Am I treating the patient with cancer? Absolutely. We have patient, as a matter of fact, the other day came in, had asthma, had a really bad asthma attack, and we treated that patient. Now, did I treat asthma? No. I treated the symptoms that were related to the asthma. After having an asthma attack, their chest was very tight, their back was very tight because they were laboring for that breath. All we did was help relax those muscles and allow the vertebra to move freely. I didn't treat the asthma, I just treated the patient with asthma. And that's what we have to get our medical colleagues to understand. They need to look for doctors of chiropractic that they can trust to do the right thing for their patients. And I guarantee if you go to your doctor and you find a chiropractor able to communicate with the doctor, you will have your doctor referring to that chiropractor, without a doubt. So the biggest thing we need to do as doctors of chiropractic, now I'm talking to doctors of chiropractic, you need to get out of your bubble, open yourself up, communicate with our medical doctor friends, and say, listen, this is what we do, this is how we do it, this is the treatment that I give my patients, and I promise you, I will keep you in the loop of what we're doing and how we're treating this patient. Every doctor that refers to me, they get notes from my office saying exactly what I did. So if you're afraid to go to a chiropractor, or if you're a medical doctor that is kind of leery about chiropractic, trust me, find a doctor of chiropractic that works well with the medical community in order for you to get the best possible care for your patients. As a doctor of chiropractic, and I also have a fellowship in orthopedics, I have allied staff privileges at a local hospital. These things make a big difference for me. Not only does my fellowship make the difference, but I'm in a medical environment so the doctors get to know me. So if you're a chiropractor listening to this, make sure you get with your medical doctors and show them exactly what you do and the benefits of how to treat the patient. And number 2, if you're a medical doctor, find a chiropractor that you can trust that will communicate with you. That way you can give your patients the best possible care that they can get. Well, I appreciate you guys listening in. I love you. Guys, have a great week and God bless.